Hi, this is Brian Wormers. We're going to be talking about family-centered care of the child during illness and hospitalization today. So within the soft shock module, we've got a couple of different objectives. So we're going to talk about stress and illnesses of hospitalized children. We're going to talk about nursing interventions to try and prevent or minimize the stress of separation during hospitalization. We'll talk about minimizing the stress of loss of control, and we'll talk about the fear of bodily injury. So this kind of plays off of the 21st century pediatric nursing one that you hopefully just watched. But looking at the stressors of hospitalization, think about all the different things. Just even you, if you were hospitalized right now, what would that mean? So you are going to be having a loss of control because you're going to be in a place that, it's probably not a vacation. There's lights and buzzers and beeps and all these different whistles and strange people doing strange things. You're away from family, you're away from friends, you're loss of control. You don't get to do what you want when you want. People are causing bodily injury for you, for IVs and Foleys and other things like that. And there's pain related to that. So now think about that through the eyes of a kid who, you as an adult, and especially now as a nursing student, you understand the why of what we're doing. The kid doesn't necessarily get that. So think about what that will mean. And especially if they're taken away from their family, if they're taken away from their friends, if they're taken away from these situations. Think about those kids who will generally thrive on a routine, especially if we're talking about like those kids that are autistic or those kids that have got special needs. Those routines are very important to those children. If we disrupt them, we disrupt their life quite a bit, and they might act out and they might, quote unquote, act badly with that, which is not surprising, right? So we really do want to be as nice as we can to them, and we're going to talk about that throughout this. So separation anxiety is one of those things, and so you can talk about stranger danger and those major things like that, but being away from parents is a major stressor. They want their mom, they want their dad, they want their caregiver. And getting separated causes a lot of anxiety for them, causes a lot of stress. They're going to act out. You can see how this little one is not really impressed being with the provider instead of with the family member. And so when we take them away, when we put them in a strange environment, when we do these different things, think about the stress that that places on. So they've got the different phases of this. And so they've got protest phase. No, I'm not going to you. I don't know you. Then they cry and they scream and they want their parents. They can refuse attention from anybody else, and then they're often inconsolable. So you can kind of see this kid's not happy, and that's normal. Honestly, I've seen it where it's gotten where the kid doesn't care about this, and that makes me more concerned. This is a normal thing for kids to go through. If the kid has been neglected, which unfortunately I've seen, and then they're not used to people holding them and touching them and talking to them and caring for them, and that makes them uncomfortable, that's a major concern. So this is normal. Realize that we deal with this. We are going to work with this, and this is something that in actuality is a good thing. But how do we deal with that separation anxiety? How do we do that? So with that, we try to provide them with things. Do they have a security item? Is it a blanket, a doll, a toy, something that smells like home, something that reminds them of their family? So stuffed animals. There's a variety of different things that this can include. But what we can see, though, is that they kind of get depressed. They kind of might not be interested in playing. They might not be interested in food. They just kind of withdraw a little bit. And you can kind of see that this kid's just kind of not actively engaged. So the final one is detachment, denial. They don't want to play. They finally will become more interested in the surroundings, and they play and they kind of detach. But like I said, though, if they are too used to being by themselves and they're detached all the time, then that's not a good thing either. So separation anxiety for parents, here's a good little article on it talking about, what it is, why it happens, and helping the parents understand it, as well as, us as nurses. So Separation anxiety is a stress imposed on early childhood, and it does have some long-term ramifications. So they've done some studies on kids that have been hospitalized frequently when they're little, and of course they've got some attachment issues later on in life. So also they've got some anxiety issues. So that makes sense, hopefully, to you. So loss of control, nobody likes this. We always like to be in control of ourselves. We like to be able to do what we want when we want. But think about kids. And kids are constantly being told what they do, when to do it, how to do it. You're too loud. You're moving too much. You're doing all these kind of things. So really, we want to try to help these kids out as much as possible. Give them some free time. Give them as much control as they have. Let them make the choices and decisions that they can. For infants, we do try to develop trust with them. So, and that's building, we're going to feed them. We're going to change their diaper. When they cry, we're going to attend to their needs. So it's coming from Erickson's, and, a deviation from that might lead into a mistrust or, not feeling that they're safe around us. Toddlers strive for autonomy. That's why they love the word no. No is a very strong word. They see that it elicits a reaction from those around them. They also hear that it's often used very emphatically. When we say no, is it no? Or is it no? So we realize that that's a strong word, and they realize it too, and that gives them power. And as they're trying to become their own person, they like that word. And so within the hospital, try to give them that power. Try to give them choices that they have. This is not, can I take your vital signs right now? That's a bad statement multiple different ways. But what happens if they say no? What are you going to do? You're going to do it anyways, probably. And so what did that do to their autonomy? What did that do to their sense of self? And within that, you just will blow through that. And so give them the choices that they have. Do you want me to do this first or this first? Do you want me to, we have to do both of these. Or which pill or what medication do you want to take first? All those things are empowering to the child to give them a sense of control in an environment where they really don't have much. So within this, we're going to see negativism, saying no, tantrums, and they might have some regression. So they don't want to eat well, not sleeping well, they don't want to bathe, toilet. They might, start wetting themselves again if they're potty trained. And playing, they might go down to a different stage. Very common, especially in the hospital when they feel like they lack control. Preschoolers, they don't like being restrained. They don't like altered routines. They don't like enforced dependency, they have to do stuff that other people are telling them. They also are famous for their magical thinking. What this means is that they wish something bad, or they thought something bad was going to happen and it did, or an event would happen, or that that they are in more control than what they are. And so an example of this that I've had in real life is that there was a sibling of a patient of mine that, when they were back home, they got into a fight about a toy, and the preschooler wished something bad to happen to the kid. Now the kid ended up in the hospital, and the preschooler is feeling guilty because he's like, well, I wish this upon them. And so realizing that can happen. And so we do need to take that into consideration. And we'll talk about family members and how this can play into it. School age, they're looking for industry versus inferiority. They're looking for productivity. They want to be a helpful thing. So how can they help? Can you hit that button? Can you do this? Can you start the vital signs on this? Can you hand me this? They really like doing that stuff. They also want to know what's going on. So for all these ages and stages, we're going to tell them what's going on, but we have to develop it in very age-appropriate language. The infants, we might not say much. The toddlers, of course, we're going to tell them what's going to go on, but we're not going to give them a 5-minute spiel like we would at adolescence of the importance of why we're doing what we're doing. So as school-age children, they want to know, they want to learn. They're really curious and they want to help, so let them. Adolescents, they're really not fond of losing control. They want to be in control. They want to be different than their parents. They want to Their friends are very important to them. So as we're looking at those ages and stages and developmentally, they also want to make sure that their peer group doesn't forget them. They want to make sure that they don't look too different than the peer group. They want to be different from their parents, but they want to be similar to their peers. And so they can have a lot of frustration. They also have a lot of fear too, if they're going to be different from their group. Individual risk factors. So some kids are more at risk than others. Think about if they're verbal or nonverbal. Think about if they've got any things like autism that makes them a certain risk. Do they have a difficult temperament? What's the fit between the parents and the child? We all know people are different. We know some people are very mellow. We know some people are very anxious. We know some people are very loud. Some people are very quiet. Think about the difference of those situations. Or think about the same. If you've got a kid that's a hothead, so to speak, and gets angry really easy and does that, and they grow up in a family with parents that are the same way, you could expect some conflict, right? I mean, that's not going to be unheard of or unexpected. But you might have a different situation than if you've got a calm parent and a calm child. Those dynamics are going to be different. So we really need to individualize this out for the kid, and then also put it in the context of the family and the group that they're around and their community. So stressors and reactions of the family. So think about this. Once again, it's holistic for that family group. So of course we're focusing on the kids, and that's what or the patients, and that's of course what we're talking primarily about before. But think about how this has an impact on the rest of the family. Think about the parents. Parents often feel very helpless at this stage. They take their child in and depend on strangers that they've never met, never screened, they've never looked at your resume, they've never, done a background check on you. They're trusting you because of your title. And how does that make them feel? And guys tend to even struggle with this even more, is what I've found. Dads feel really out of touch. They want to be helpful. They want to do something. And when they're powerless and at the mercy of other people, it's really tough on them. Think about the effects that this will have on their jobs. Think about financial stress. Think about emotional stress. Think about the relationships within the parents, if they've got a child that's always in the hospital. So just some considerations as to how hospitalization will affect the whole family. For siblings, think about that as well. We talked about magical thinking, and they might feel guilty. They might be jealous. I've definitely seen that before, where people come up, they give them the patient balloons or toys and stuff like that, and the siblings are going, hey, why does he get all this stuff? I want toys, I want presents, I want attention. So realizing it's going to impact the siblings too. And it might impact the siblings, and the siblings don't get to do things. If this is financial resources or time or all these different things, this is definitely going to impact the sibling. Extended family, so you might have people helping and guiding and taking care of other family members. Same with family and friends. They'll put role stress on those because you don't see them. So all these different things. So think about how this hospitalization and illness and these different types of health situations impact not only the patients but everybody around them. So in caring for these children, we do try to minimize these stressors, as we talked about before with atraumatic care. So we're going to prioritize and prepare them for hospitalization as much as possible. If they're going to have an elective surgery, oftentimes we can take them in before. We can give them a tour. We can show them the operating room. We can show them the different rooms. We can do prep work for them. If they're going to have procedures done, often child life will come in, or a nurse will come in and do some explaining for what's going to happen next at an appropriate level. They can use teddy bears or dolls to show them, this is an IV. This is like a straw for your body that's going to give your body a drink. And we'll use appropriate terms, and we'll talk about that a little bit later. But if we can prep them for hospitalization, all the better. If we can prep them for procedures or surgery or any of those things, it does help them out. We do want to try and prevent or minimize separation as much as possible. We let the parents room in. That's not a big deal. Because we realize the value that that caregiver has for that child. So, if they can't stay with the child, encourage them to leave things that are their favorite. So their stuffed animals, their dolls, their blankets, their whatever brings them comfort. So try to minimize that loss of control. Think about how scheduled these kids are. So if they go to school every day, and generally speaking, those school days are very similar. They get up at this time, they eat breakfast, they get ready, they go to school, and in school they've got it all laid out. This is my teacher, and these are the things that we do. And if we take that away from them, some kids really struggle with that. And like I said, some kids, like especially those that have autism or other things like that, are really thrown off their schedule, and that can be very tough on them. So sometimes what's best for them is trying to maintain a similar schedule. I have also met kids that their parents are on a night shift. So guess what? The kids will sleep during the day, and they're up at night because that's the schedule that their parents are on. And you can debate whether that's right or wrong, but think about then switching them into a hospital setting in which the doctor's always around at 6:30 or 7 o'clock in the morning, and then you do all your skills and you do your vital signs on a schedule during the morning, and you do your procedures usually during the morning, and that might not be what that family is used to. So we do need to take that into account. We can't, bend over backwards and do everything for them because, the rest of the hospital doesn't necessarily work on that timeline. But have consideration for it and think about what we can do to make this as atraumatic as possible. So encourage that independence. Have them do self-care as much as possible. Have them take their own shower. Have them bathe. Have them brush their teeth. We want them to, especially if we're talking about industry versus inferiority, if we're talking about autonomy, if we're talking about these different things, think about what that means for those kids in the hospital. Think about how to maximize those things and promote that independence. Bodily injury, we all have this to some degree. Kids can be interesting because they don't fully understand how the body works. If they're bleeding out, what's to say that that's going to stop ever? If they're bleeding out, some of these kids will think like, well, I'm going to lose all my blood and then I'll die. And so realize that some of these things could be a major concern for these kids, and it might not be, rooted in realism, but you have to remember developmentally this is maybe what they think. And so Band-Aids can be a very therapeutic thing. We are very careful in the younger groups so they don't suck on them or choke on them. So with infants and babies, oftentimes we're trying to avoid, Band-Aids and cotton balls and stuff like that. But if an older child wants a badge of courage, is what I've heard them called sometimes, generally speaking, give them a Band-Aid. It costs cents and it makes a big deal for them. So, as they get older, they do start to understand more. They have a heightened sense of body integrity, especially private parts. They tend to be very sensitive with those. So if we're doing Foleys or different invasive things like that, of course, they're going to be very concerned. You need to do a good job of walking them through what you're going to do. So if you're doing procedures, if you're doing examinations, if you're doing diagnostics, walk them through, help them, guide them, and, provide for them. And honestly, I think we should be doing that for all ages and stages, including our adults and our geriatric population as well. So, provide appropriate activities and opportunities for play. Play is how they grow. Play is how they learn. Play is how they develop. Play is how they interpret the world around them. So let them do things which is normal for them. Let them do arts and crafts. Let them play. Let them use toys. Let them read books. Let them do the things that they normally would do outside the hospital as much as possible. Let them do schoolwork. I know that that's not always a popular thing, but often hospitals will have teachers within the school and to help out with this schoolwork. Also, talk about peers. You know, how can you have that connection? How can kids do these types of things? We've done everything from doing video conferencing so kids could be in their classrooms and participate, to, you know, having a group of teenagers come up. Although that's got to be navigated carefully, because so independence versus they don't want to feel weird and different, and if they've got tubes and lines and wearing a stupid hospital gown, they might be a little self-conscious with that one. So, but think about the ways that they can play and interact with their peers, interact with their world. Also along those lines, think about what that might mean. Think about when they're playing with dolls, how do they act with that? How do they draw pictures, and what are they drawing up? That can actually give you some glimpse into their world. And so it's very important when you look at that and you can see the functions of play. So support the family. How can we do that? How can we do that financially, economically, socially, culturally? So we want to be there for them, support them, and realize that they might have different ideas and needs than what we might think. So oftentimes, good communication, and sometimes just asking, how can we help you? What do you need? We want to help. What's going to be the most useful for them? Some people got a lot of money. Some people got great insurance. That is not a stressor. I know, right? And so you have to ask. You have to do the questions. You have to figure out how you can best help that child and that family, and work with that. And so we've got different ways to do all these different things. So also the family members, when a kid is hurting, when the kid is going through procedures, when there's scary events, if they've got cancer and we're worried about treatment and modalities and what we're going to do with that, that's hard on the family members too. So be there, ask them, support that family as much as possible. And then think about the special situations that we have. Think about all the different situations that these kids can be in. This PAPR is awful. It's no fun to try and build rapport with a little kid when they think that you're a space alien. And you've got this weird, loud thing on them that's they've never seen before, and it impacts your relationship with them from the time that you walk through that room. And so, what's it mean if they're in the hospital? What happens if they go outpatient? What happens if they're in isolation, whether that's contact, or droplet, or using PAPRs? What about if this is an emergency? Think about an ICU stay where they're very sick. So all these different situations can definitely impact patients and their family members. And just think about all those different ways. So, all right, I know there's a lot to consider when we're caring for kids in the hospital. This is something I do think that you should consider in adults as well. I don't think that we do. I think we often glaze over this, and oftentimes we put our views upon our patients. But I think we've got a lot to learn. But it's really, really important aspect of pediatric nursing. All right, that concludes this lecture. If you have any questions, contact me.